our program on the California end-of-life option. Today's program is co-sponsored by Concerned Citizens, the Laguna Woods Democratic Club, and the National Council on Jewish Women. Our speaker today is Samantha Trad, the California State Director for Compassion and Choice. As the nation's leading nonprofit organization, Compassion and Choice works to improve care and expand options for everyone's end-of-life journey. Samantha works to expand patient-centered and patient-directed end-of-life care across the state. She is an expert on implementing medical aid in dying and leads education and outreach efforts to eliminate barriers for eligible patients who want medical aid in dying under the California law. Previously, Samantha taught American politics at the University of Redlands and was executive director of the Arizona Advocacy Network. She has a bachelor's degree in political science from the University of Redlands and a master's degree in international economic and political studies from Charles University in Prague. Samantha, do you want to begin?
Yes, thank you so much, Nancy, and thank you all for having me. I am so grateful to be able to talk to you all today. Let me pull up my presentation here. All right. So Compassion and Choices, we're a nonprofit organization that works to improve care, expand options, and empower everyone to chart their own end-of-life journey. We actually have a sister organization called the Compassion and Choices Action Network. It's a 501c4 that I'm the California State Director of and that I'm doing today's presentation through. I want everybody to think about some questions for themselves. My first question for everyone is, how many of you here today are going to die? Anyone? Of those of you who are going to die, how many of you would like to have a peaceful death? How do you envision your death? This is something we don't like to talk about or think about. But the good news is that talking about death isn't going to kill you. And actually, it can help you have a better end-of-life experience for you and your family. Study after study shows the same thing. The majority of people want to die at home with loved ones, with pain and discomfort managed, and having their spiritual values respected. Unfortunately, the reality is that many of us end up dying in hospitals, hooked up to machines in exactly the way that we don't want. Medical aid in dying, which I'm going to talk about today, is one of many end-of-life options, which is really important to talk about. You know, many people choose to pursue life-sustaining treatment. Refusing or discontinuing treatment can actually be a wonderful end-of-life option that we don't always talk about. Also, hospice is a wonderful thing that you can enroll in. Voluntarily stopping eating and drinking can, it sounds like it can be very difficult, but the reality is when you reach the end of your life, your body naturally starts shutting down. So you're not hungry, you're not thirsty. And as long as your pain is managed, this can be a really beautiful end of life option, depending on what ails you and why you're at the end of your life. Continuous deep sedation is an option people sometimes choose. And then of course, medical aid in dying, which I'll talk about today. And it's important to note that these options are not mutually exclusive. We encourage everyone to enroll in hospice at any stage of end of life. Oh. Let's see. My slides got stuck. Oh, there we go. On October 5th, 2015, Governor Brown signed the End of Life Option Act into law. He said that, he's Catholic and he wasn't sure if this is something he would ever choose, but he realized this is not something he should deny of other people. The California Healthcare Foundation did a really excellent study at the end of 2019 where they asked people if they support having the option of medical aid in dying, and 75% of Californians across the state said that they support the End of Life Option Act, which stays in line with every survey we've ever seen. And what was exciting about this is they looked at different demographics as well as counties, and the majority of every demographic supports the End of Life Option Act. I'm excited to say that we now have 11 US jurisdictions that have authorized the option of medical aid in dying. California was number 5. And yesterday, I got to watch the governor of New Mexico sign a bill into law as New Mexico becomes the 11th jurisdiction to authorize medical aid in dying. On this map, you can see the light blue states are all the states where aid in dying is authorized. The yellow boxes are where we have active volunteers, and the dark blue states are where we have legislation to authorize the option of medical aid in dying. So what is medical aid in dying? In short, it is the option for a person who is terminally ill with 6 months or less to live, who is an adult, who is of sound mind, to have the option to get a prescription for aid in dying medication to peacefully end their suffering. Medical aid in dying is not considered suicide or assisted suicide. In fact, that term can be really offensive to people. The people who choose medical aid in dying do not want to die. Their terminal illness has robbed them of life. And what aid in dying does is it gives them a little bit of control over something that they've lost control over. Wills, contracts, insurance, and annuity policies are not affected. In fact, the underlying illness is what is listed on the death certificate. In fact, just having the prescription gives dying patients a huge sense of relief. I'll never forget a man I met who told me that he never felt more alive than the moment he got his aid in dying prescription. And he said, I know it sounds crazy, and I hope I never have to actually take the medication, but he had been so anxious about the course his terminal illness was going to take him down that he just felt so relieved that he had this other option, that he didn't have to go down the trajectory of his terminal illness, but that he did in fact have the option now of medical aid in dying. And he actually never even took his medication. He never was at a point where he felt like he needed to. And in fact, this is something we see often. All of the states that have authorized medical aid in dying, about 1/3 of the patients who go through the whole process to get their medication never actually use it. But just having it on hand really helps give them a huge sense of relief. In fact, sometimes patients say they feel better, their symptoms are even better after they get the medication because their anxiety is relieved. The eligibility requirements for the End of Life Option Act include you need to be a California resident, you need to be 18 years or older. Like I mentioned, you need to be terminally ill with a prognosis of 6 months or less to live. You need to be capable of making medical decisions. This means this is not an option for someone who has advanced Alzheimer's. You have to be able to advocate for yourself that you want the option of medical aid in dying. And finally, you need to be able to self-ingest the medication. Now, these core eligibility requirements are maintained in a bill that I'm going to talk about at the end. So SB 380, which we'll talk about, it keeps this in place. We believe that it's really important for these eligibility requirements to be met. So what are the steps? It's very complicated. And so I'm going to give you the cliff notes on how you would access an aid in dying medication. The most important thing is to talk with your doctor. Now, this is something you want to do even before you're sick, if you think that if you were terminally ill, that this is an option that you might want. I myself have talked to my doctor because it's an important value to me. I want to know that if I were terminally ill, that my doctor would support me in this option. And for a lot of doctors, they've never even thought about medical aid in dying. In fact, some doctors don't even know that this law exists. They're not trained necessarily in residency, which is something we're trying to change. But they may not have ever thought about it. So you want to make sure you have a doctor who will support you in this option if you think it's something you might want. Now, if your doctor says they won't support you, there's a few things that you can do. First of all, you need to ask your doctor why. Are they allowed to prescribe? We know that 97% of religious hospitals in California and healthcare systems don't allow their doctors to prescribe. So this is like St. Joseph's, Dignity Health. If their doctor wants to support you, they're simply not allowed to. Are you their first patient requesting this? Like I said, they might need time to think about it. We have a wonderful free confidential consultation that your doctor might be interested that they can call or email and talk to a doctor who has supported a patient through the option of medical aid in dying, so that your doctor will hopefully feel more comfortable in supporting you in the option. You can also ask your doctor to refer you to a doctor who will support you. And finally, you can call our end of life consultation line for support if you're having problems finding a doctor who will support you in the option, assuming you meet those eligibility requirements. So first of all, the most important thing is to find a doctor who will help you write the prescription for you should you qualify. The doctor who you find will be the main one to help shepherd you through the whole process. This is important because you actually need two doctors. So you have one doctor who does most of the work. And in fact, you have to make 2 oral requests to the doctor separated right now by a mandatory minimum 15-day waiting period. You also have to have a second doctor confirm your eligibility, and you have to submit a written request that is signed by 2 qualified witnesses. So as I said, you need to make your second request to the main doctor separated by a minimum of 15 days and complete a written request. Now, the 2 witnesses who sign your written request, there are different eligibility requirements for them to make sure you aren't under any coercion. And we have free resources to help you through this process. So if you feel overwhelmed right now, don't worry. We are happy to help you. And like I said, the most important thing is finding that supportive doctor who can help shepherd you through the process. And while it sounds complicated, the good news is we know it is possible to make it through. In 2019, 246 unique physicians wrote 618 prescriptions and 405 people ingested the medication. In fact, we have data from the first 3.5 years that the law was in effect, and we know that nearly 2,000 prescriptions were written and nearly 1,300 people ingested aid in dying medication. The next report for the Department of Health will come out in July for 2020. What we've learned, what we don't know are how many patients couldn't access the law. The California Department of Public Health only collects information for people who actually make it through. So we've talked to our friends at healthcare systems like Kaiser, Sutter, City of Hope, and what we've learned is that about 1/3 of terminally ill adults who want the option of medical aid in dying, who meet all the requirements, die during that mandatory minimum 15-day waiting period. Now, some of you may know this, but it's similar to hospice. Many people wait until the last minute to enroll in hospice, and they're only on hospice for maybe 1 or 2 days before they pass away, when really, hospice can often be enjoyed for up to 6 months. And we see the same thing with medical aid in dying. Patients wait too long to make their first oral request, or they have problems finding a doctor. So by the time they find that doctor, they can't survive the 15-day waiting period. There are other challenges to access. This is a picture of Christine Whaley and her husband, Tom. Christine was 36 years old when she was diagnosed with terminal cancer. She tried everything she could to extend her life. And when it was clear that nothing was going to work, she asked her doctors for the option of medical aid in dying and was shocked when they told her they couldn't prescribe to her. She was in San Luis Obispo at a Dignity Health and ended up having to drive all the way to UCLA multiple times in order to access the law. And thankfully, she was able to, but she didn't want to have to spend her final weeks fighting to be able to access this law. And we hear this story over and over again. And that's why it's so important that you're here today learning about the law so that you have the tools you need to empower yourself to make this decision if it's right for you. Keeping and improving the law. So there is a wonderful bill that we have spent a long time working on with healthcare systems, hospices, physicians, nurses, that that Senator Eggman is authoring along with Assemblymember Wood. It's in the state legislature right now. And as I said before, it maintains the eligibility requirements, and it reduces the mandatory minimum waiting period from 15 days to 48 hours. This is very exciting because we know that hundreds of patients who would have been able to access the law will now be able to, if we're successful in getting this bill all the way through. In fact, New Mexico's law, which I said was just signed yesterday, their waiting period is 48 hours. Now, all medical aid in dying laws, other than Montana, their laws are modeled after Oregon. Oregon has had their law for 23 years, and Oregon had a 15-day waiting period in it. Now, Oregon also saw the exact same problems we've seen here in California. And now in Oregon, they've amended their law so that the doctor can waive the waiting period entirely if the patient's unlikely to survive it. However, it's become clear that 15 days is way too long, and really 48 hours makes a lot more sense than forcing a patient to wait that long, especially when you're terminally ill. Other provisions of the bill: healthcare systems and hospices would need to put up their policies on their public websites to increase transparency. Something we hear a lot is that people don't know where they can go to access the law. And so we think having it on your website, it builds transparency. So if you don't let your doctors support patients, then have it, make it clear on your website. It also clarifies that the first oral request needs to be written in the patient's medical record, so the clock on the waiting period can start as soon as the patient makes that first oral request. And finally, it eliminates the sunset provision. The only way we were able to get the End of Life Option Act passed was by adding a sunset. And the law will expire, and we will no longer have this law if we don't reauthorize it by the end of 2025. So even though it's early, we wanted to start now to make sure that we always have the option of medical aid in dying under the End of Life Option Act and that it never expires. What are the steps to pass SB 380? Well, I'm excited to say that it passed out of the Senate Health Committee on an 8-1 vote on March 24th. And it will next be heard in the Senate Judiciary Committee on either April 20th or April 27th. Once it passes there, it'll go through appropriations. It doesn't add anything to California's budget, so we anticipate it going pretty easily through that committee. Then finally, it'll have to pass through the Senate floor. Then it goes through the same song and dance in the Assembly. It'll be referred to committees in the Assembly like Health or Judiciary. It'll need to pass through those committees and then finally pass through the Assembly floor, hopefully, by August, and then be sent to the governor, who will hopefully sign the bill into law. If you support this bill, and I'll answer questions shortly, we would love your help to tell your representative to vote yes on SB 380. We have a really easy form you can use where you just put in your name and address and your representatives will come up. We have a suggested letter you can send that you can edit to make it personal, and it'll be sent straight to your representative so that they know that you support this bill and the option of medical aid in dying. If you're interested, you can help us get individual organizational endorsements. We have a petition you can sign. You can sign up for phone banking, help us find storytellers. The most compelling thing are people who've had personal experiences with the law. It really helps people understand why this is so important to be able to have this option. So if you have a friend or family member who has gone through this process and you want to share their story, or who wasn't able to access the law and wanted to, please let us know, and we're happy to help share that story if you would like to. Talk to your friends and family. You can virtually attend lobby days when we have them. We had a great Senate virtual lobby day not that long ago. Other ways to help, like I said before, talk to your doctor, find out if your doctor will support you. I know I sound like a broken record, but I can't emphasize that enough. It's very hard to find a doctor when you're healthy, and it's a million times harder when you're terminally ill. So make sure you've got your doctors lined up. You can volunteer with us. We love our volunteers. We have the best volunteers on earth, in my opinion. And you can connect us with groups or organizations that would like to have a speaker give a presentation about the End of Life Option Act. We also do presentations on advanced healthcare directives, end of life options for people with dementia, and other presentations in the realm of end of life. You can also connect us with medical professionals who would like to learn more about the law. We do a lot of doc-to-doc clinical education, educating nurses, social workers, and talking to healthcare systems. This is a beautiful picture of Brittany Menard. You may remember her. Brittany said, having this choice at the end of my life has become incredibly important. Who has the right to tell me that I don't deserve this choice? Brittany was 29 years old when she was diagnosed with terminal brain cancer. Her story went viral when she shared it on YouTube about the fact that she couldn't have the option of medical aid in dying here in California. She was a California resident. She ended up moving to Oregon, where she was able to access the law. Once she got her medication, she traveled the world with her family until it was clear that it was time, that the end of her life had come. And she was able to peacefully end her suffering the way she wanted in 2015 on November 1st. After talking to Governor Brown, I must add, and encouraging him to sign the End of Life Option Act. And honestly, I don't know if he would have signed it without Brittany. So we're grateful to her and her husband, Dan Diaz, who continues to advocate for the option of medical aid in dying. We have tons of free resources and tools. As I've told you, if you go to our website, compassionandchoices.org/California, you can find them there. We have resources available in English, Spanish, and traditional Chinese. We also have a COVID-19 toolkit, although, you know, as more and more people get vaccinated, I don't know how useful this will be, but this talks about the different end-of-life options you have and the realities of COVID-19. So if you want to have an addendum to your advanced healthcare directive in the case of COVID-19, we can provide that for you so you can make informed decisions about what you personally might want should you get COVID-19. You can sign up for a presentation. You can follow us on Twitter, Facebook, YouTube, and Instagram. And here's my information. You're welcome to reach out to me anytime. I'm not too far from you in Redlands, California. My number is 909-253-9593, or you can email me at strad@compassionandchoices.org. We rely on donations. 95% of our budget comes from individual donations. So if you feel compelled, we would be grateful for your support. And with that, I will see if we have any questions that I'm happy to answer. How does Death with Dignity deal with ALS? That is such a great and important question. So the law says that you need to ingest the medication. And what that means is a person, usually the most common aid in dying medication is a powder that you stir up with liquid and a patient drinks. So you can hold the cup up to the patient's face. You can even hold the straw for them, but they need to be the one to bring the medication into them. If the patient has a feeding tube, that also works as long as the patient is the one who pushes the plunger. And there's also something called an anal catheter that a patient can use. If again, as long as they're the ones to push the plunger and ingest it themselves. ALS is actually the second most common terminal illness that people have who use the option of medical aid in dying, with cancer being the most common terminal illness. So it is a possibility depending on where you're at with ALS. Are there drugs prescribed uniform for everyone, or do they vary from case to case? That's a great question. They vary from case to case. So, you know, it really depends on the illness you have. You know, if you have ingestion issues, then, you know, your doctor may want to do something different than have you swallow the medication. And this is something we don't write into the law because medicine is constantly changing. So it's really important that's not written into the law so that, you know, science can evolve as more aid in dying medication is created. With no waiting period, wouldn't some people make an emotion? That's an excellent question. So first of all, there would still be a 48-hour waiting period. And I can tell you, nobody makes this decision lightly. First of all, it's something that you have to ask for multiple times. You know, you need to ask your main physician at least 2 times orally. You also have to have a written request, and you need to ask a second doctor. And both the main doctor and the consulting doctor are going to evaluate you and make sure you're not making this decision lightly, that this isn't out of some form of depression, that, you know, you really understand what the aid in dying medication is for, and understand that you want to use it to peacefully end your suffering. So, you We have 60 years of combined data from all the states that have authorized medical aid in dying. And in 60 years, there has never been a single incident of coercion or abuse. The only problems we hear about are these heart-wrenching stories of people who don't survive the waiting period or who can't access it because of other barriers. And it may not sound like much, but when your loved one is dying, it's already traumatic. And when you can't give them the end of life experience that they want because of an arbitrary 15-day waiting period, it's not only difficult for the patient, but for their family, as well as their medical team. I mean, I've talked to doctors who still feel so awful that they were not able to support their patient in this option because they couldn't survive that long 15-day waiting period.
Samantha?
Yes.
Hi, I'm Maureen, and I have some questions that were sent in ahead of time. So why don't I ask a couple of those? One of them said, and I think there's two questions here that are connected. Should we video our end-of-life wishes, and how should we talk to our children about our wishes, especially if they're not comfortable with our choice?
Those are great questions. So first of all, you should all have written advanced healthcare directives. You need to have them with you at all times if possible. And I think videoing them is genius. It's not hard to do. You can do it with your smartphone. And this can help your family because sometimes your family might say, well, no, mom said this. No, she didn't. Mom wanted this. Well, if they have that video of you, there's no debate. And, it's hard. Nobody wants to think about this or talk about it. It's so difficult. But, we have resources on our website that you can show them to try to start the conversation. I will say Diane Rehm has a wonderful documentary that is being released this week on PBS. So you can look up what time it's on for your PBS station, but that could be another way, invite your family to watch this documentary and then ask them, well, what did you think about it? And start the conversation that way. I know with my own parents, we did it over a bottle of wine and a nice dinner, but that's not right for everyone. So, it's hard. And when people disagree, I encourage you to find a healthcare proxy who will fight for what you want. Before I started this job, I didn't know there was such a thing as death doulas, and they're just like birth doulas, but for death. And they will advocate for you and make sure you have the end of life experience you want, just like a birth doula advocates for the mother to make sure she has the birth she wants, as much as you can.
Okay, another question was, how much does it cost, and does Medicare pay for any of it? And what should we know to put aside for this?
That's a great question. And I just noticed somebody asked about the PBS program. So I'll answer that and then talk about that question. So Diane Rehm is the woman who is featured in it. It's based on her book, and it's called When My Time Comes. When My Time Comes. And it should be playing this weekend. Medicare does not cover medical aid in dying because in the 90s, when Oregon passed their law, Congress passed an act that restricted federal funding from anything that has to do with what they call assisted suicide. And because of that, no federal funding dollars can go towards medical aid in dying. That includes VA benefits. However, in California, Medi-Cal does cover aid in dying medication. I've never heard of a private insurance that doesn't cover medical aid in dying. What we find though is that a lot of people pay out of pocket, and the medication itself tends to run between $400 and $600 right now. Your visits should be covered. They can, I think, be covered under Medicare because it's an end of life consultation. So it's really the aid in dying medication that you need to save up for.
Okay, let's see, there's another question here. What documentation do you need to have ready in order to access the end of life option? And I think somebody in the chat just asked something similar to that. Do you have to have a witness present to affirm that you were the one that self-administered the drug?
Yes, so those are two good questions. So the documentation, the only documentation the patient really needs is the written request. The main doctor who ends up writing the prescription has a lot of paperwork, and the consulting physician also has a lot of paperwork. And I forgot to mention, you can also have an optional third mental health assessment to really make sure that the patient understands why they're doing this and that it isn't, out of depression or that they have advanced Alzheimer's. So that's another possibility. You don't need to have someone present. We encourage people to. I think it's nice to have somebody there, but every once in a while, there are people who absolutely don't want anyone around when they take the medication, and they're allowed to do that. It's their end of life. But you can have someone present if you would like to. Hospice doesn't always do this. This is another important thing. When you do go on hospice, we encourage everyone to interview your hospice. Ask them if their staff is allowed to be present when you take the medication, because some hospices won't let their staff be present, which there's no reason for it. They just have overly zealous lawyers who are concerned, and they absolutely don't need to be. Somebody asked about Kaiser, and I've got to say, Kaiser's wonderful. Kaiser has one of the best systems to make sure that an eligible patient can get through. Both Kaiser Northern and Southern California do allow their doctors to practice. Other great healthcare systems, the UCs are great. The City of Hope, they all allow their doctors to practice medical aid in dying.
Another question that we had here was, are there disparities in who has access to the law?
Great question. There are disparities at the end of life, just like there are in all of healthcare, unfortunately. We don't know exactly why, but what the data shows is that, first of all, we saw that poll. The majority of every demographic supports the option of medical aid in dying. 70% of Black Californians, 68% of Latino Californians all support the option of medical aid in dying. But what we see in the reports is that the vast majority of people who access the law tend to be white. They tend to be over 65. They tend to be highly educated. So we don't know exactly why that is. We also know that regionally it can be difficult. I live in San Bernardino County, where there's a lot of Catholic influence, and it's very hard to find a doctor here. That's partly because there are a lot of religious healthcare systems that don't allow their doctors to practice. But also, I think, unfortunately, there's still this stigma around medical aid in dying, which is completely unnecessary. And this idea that death is failure. I think a lot of doctors see death as failure, but the true failure is not listening to your patient and giving them the end of life experience that they would like. Somebody asked in the chat, you mentioned dementia. Is this covered in the act? No. If you have dementia, medical aid in dying is not an option for you. I know this is very upsetting for a lot of people, but I'll tell you, it's going to be hard just to remove the sunset provision with the law we have. And there are other very compassionate end-of-life options that a person with dementia can use. We encourage everyone to fill out an addendum to your advanced healthcare directive, specifically in cases of dementia. There's different stages of dementia, and it's really important to make it clear what you want depending on the stage of dementia you have, because it's going to be different for everyone. And we actually have kind of like a little quiz on our website where, they'll ask, okay, if you don't remember anybody's name, but you seem happy, you can still, go to the bathroom on your own. What do you want? Sustain treatment if you get ill, refuse treatment if you get pneumonia, right? Voluntary stopping eating and drinking. So you can go through and fill that out, and it'll generate an addendum to your advanced healthcare directive at the end of it.
Let me see. You said that there's a lot of paperwork, but it's the doctor that has to fill out most of it?
Yes, this is another deterrent, to be honest, for doctors. They don't want to fill out all the paperwork because they're busy. So another reason, talk to your doctor early.
And if your personal doctor is not in favor of it, how does one go about finding one that is?
Well, first of all, I would urge your doctor to refer you to a doctor who will. If they can't do that, if they don't know anyone who does, You can reach out to us. You can reach out to me personally. You can reach out to our end of life consultation program. There's another organization called End of Life Choices California, where they will help you find a doctor who will support you in that option.
And I'm
And we
assuming
can
that,
refer you to them too. Sorry.
I'm assuming then that basically has to be taken care of well in advance, because you don't want to go shopping for a doctor on your last leg.
Yeah. Yeah. Hopefully. This is another reason why, I'm very excited about the 48-hour waiting period, because I do think that if patients find themselves in this situation, maybe they will have that opportunity to find a doctor to support them if the waiting period is reduced.
I don't know if Harriet is still there. She had her hand up.
Oh, yes.
I was just answered about the question of dementia, because this is something so many of us are afraid of, and we don't want to be financial or otherwise burdens to our families. The second thing I wanted to tell you is that my husband just went through hospice and died in August, and I had a very good response from a social worker in hospice. She gave me the name of a doctor, and when I called him, he was willing to come and administer almost all the way from San Diego up to Laguna Woods, or he would send the medicine with directions. Fortunately, or not, my husband decided not to use it and waited it out. But it was there if we wanted it.
Thank you for sharing, Harriet. I bet I know the doctor that you worked with. That's, that can be really hard, but it sounds like your husband was able to have the end of life experience he wanted.
Yes.
I do want to reiterate what I said about dementia, because 1 in 3 adults are likely to have dementia. And it's so important to have your wishes documented while you're still sound of mind, and to share that with your family members so they know this is what mom wants, this is what dad wants, and have that with you, so that if you do end up with dementia, your wishes will be honored. And again, you want to find a doctor who will support you in the case of dementia, because right now, the vast majority of people, they think that it's compassionate to force feed mom when she can't remember who you are anymore, because that's what we do, right? It's cruel not to feed someone. But the reality is when your body's shutting down, you're not hungry anymore. Maybe mom would have wanted you to stop eating. She would have wanted to stop eating so that she could peacefully end her life, as long as her pain was managed. But if you don't have those conversations, if you don't have it documented, people don't know what to do when you reach certain stages of dementia. Now, if you have early onset dementia, you can still fill out an advanced healthcare directive, and it should be honored. So that's really important. I encourage all of you to do that if you haven't already. And again, there are a number of compassionate end of life options that are available to you, even though medical aid in dying isn't.
Samantha, there's another question on the chat from Sue Deering.
Yeah, great question. What does the end of life look like with the medication, and how long does the process take? So, like I mentioned, the majority of people end up drinking the medication. A person usually falls asleep within 5 to 15 minutes, and then they peacefully, they never wake up. Sometimes that can take 5 minutes. I've heard stories where the family was shocked because the patient fell asleep and died very rapidly. But sometimes it can take up to 1, 2, 3 hours for the person to die. So we do encourage people to have someone else there with you when you take the medication, but it's not required under the law.
How do you find the appropriate hospice person? And what kind of costs are involved with hospice?
That's an excellent question. So hospice is covered under Medicare, which is wonderful. And you're at the end of your life, hospice will come in and take care of you, even if you choose the option of medical aid in dying. And the right person to talk to, it's, that can be challenging. I'll be honest. But this is another reason I'm so excited about SB 380, because it's going to require hospices to put their medical aid in dying policies on their website. And right now there are actually hospices that are really proud of the fact that they offer the option of medical aid in dying to qualified patients, and they will make sure that you are taken care of. But every hospice is a little bit different. So you got to call around, you got to interview. Unfortunately, that's where we are.
Thank you.
Yeah. Orange County has some pretty good hospices. I will say if you go on our website, we have something called the Find Care tool, and it lists hospices and what we know of their policies right now. So you can make a more educated decision about who you want to start calling. But we actually have a team of volunteers who routinely call hospices to try to find out, what is your policy? Who do I call? So you can find that on our Find Care tool. I don't know if I can do this, but Nancy, I'm happy to send an email with these resources after.
If you send it to me, we can send it out to
Great.
everyone. So thank you.
Yeah.
Let me just check if are any more questions from anyone or comments. Okay. Well, Samantha, we really appreciate your time today and the information that you've provided. This is a difficult topic, obviously, for all of us, but it's really important. And for me, having had a good friend who took advantage of it, and I know something about the process, and I know what it meant for his wife when he was able to do that. So I would just reiterate what Samantha said. It's important to have these conversations with our children, and it's important for us to think about how we want to manage our own end of life. So thank you very much, Samantha.
Thank you.
I just saw something that Sue put up on the chat about Valley Oaks Hospice as being one in Orange
They're
County.
wonderful. Yeah, I know their executive director. Seasons Hospice is also wonderful. Both great hospices. And if I have 2 minutes, can I share a story?
Yes, I think you can.
I'll share Jane Roberts' story because she loves it when we share her story. Jane lived in Redlands, where I live, and her husband was shocked when his doctor said they wouldn't support him in the option of medical aid in dying when he was diagnosed with a terminal illness. And so they had to search for doctors, and finally found a doctor. And, Jane talks about how Jay every single day would ask her, how many days left? How many days left? That 15-day waiting period was absolutely hell for them. Nobody wants to spend their final weeks like that, just in pain, agonizing pain. He was worried about losing eligibility, I think. And, Jane said the moment the 15 days were up and his prescription was ready at the pharmacy, she went and got it, brought it home, and he took it immediately. He was just in overwhelming pain. And, she's so glad he was able to have the option, but she just doesn't think anybody should have to wait through 15 agonizing days to be able to access this law. And, and there are 13 steps that are intact. Even after SB 380 passes, a patient still has to go through 13 steps to access the law. So, it is a safe law. And it's really a beautiful, compassionate end of life option. And it helps give people language to talk about end of life, which is great. If it's not an option for you, that's okay. There's others. And this can help you start that conversation with your doctor.
Thank you. And are those 13 steps on your website, Samantha?
Yeah, I can send that to you as well.
Okay, terrific. I think, PJ, we're out of time. So thank you very, very much for a really informative and helpful presentation. And thank you for all of you, the 27 or so people that participated in this program. And we're so grateful to be able to have it on television, our local TV station, for 5 or 6 times. So we should have all of Laguna Woods informed about what they can do.
Thank you so much.
Thank you.